Hello, I'm Jones Muna. Today, we are going to look at the coronavirus disease, or COVID-19 to be specific. My outline of the presentation will be as follows: introduction, definition, incidence, risk factors, causes, incubation period, mode of transmission, clinical features or signs and symptoms, diagnosis, treatment, complication, prevention, precaution for the sick person, was COVID-19. Coronaviruses are a large family of viruses that cause respiratory infections. These can range from the common cold to more serious diseases, such as severe acute respiratory syndrome abbreviated as SARS and Middle East respiratory syndrome abbreviated as MERS. Coronaviruses are also said to be zoonotic, meaning they are transmitted between animals and people. COVID-19 is a respiratory illness that can spread from person to person. However, it is also important to note that the disease can also affect other organs with receptors appropriate for the virus fusion. Let's now look at characteristics of coronavirus. The virus is large, so it does not settle in the air for a long time but on surfaces. B. On a metal surface, it will live for 12 hours on fabrics, 9 hours on the hands, 2 hours. C. The virus cannot survive when exposed to a temperature of 26 to 27 degrees Celsius. D. It does not live in hot regions. For incubation period, it is 1 to 14 days up to 24 days. Incidence: coronavirus affects all ages and gender but common in older people, probably because of decreased immunologic response to infection and the metabolic alterations associated with aging. Epidemics are most prevalent in Asia and Europe than in Africa. Causes: the virus that causes COVID-19 is a novel coronavirus that was first identified during an investigation into an outbreak in Wuhan, China. Coronaviruses were first identified in the 1960s. Risk factors: based on what we know about coronaviruses, other people most at risk of serious infection are people with compromised immune systems such as people who have cancer. Elderly people. Aboriginal and Torres Strait Islander peoples, as they have higher rates of chronic illness. People with chronic medical conditions. Overcrowding with infected people. People in detention facilities. Very young children and babies. Poor hygiene. Drinking water that contains coronavirus. Those who live in or have recently been in an area with ongoing spread of COVID-19. Note: at this stage the risk to children and babies, and the role children play in the transmission of COVID-19, is not clear. However, there has so far been a low rate of confirmed COVID-19 cases among children, relative to the broader population. Mode of transmission: direct transmission, respiratory droplets produced when an infected person coughs or sneezes. Indirect transmission, by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes, but this is not the main way the virus spreads. By touching an infected person's hands or face, or by touching things, such as doorknobs that infected people have touched. Clinical features or signs and symptoms. We have cardinal signs, as follows: 1 fever, 2 cough, 3 shortness of breath. On other signs, we have 4 breathing difficulties. 5 runny nose, 6 sore throat, 7 muscle ache. 8 fatigue. For less common symptoms, we have 9 headache, 10 diarrhea. 11 coughing of blood. Note: some people who are infected may not get sick at all, some will get mild symptoms, from which they will recover easily, and others may become very ill. Testing and diagnosis: your doctor will decide if you need testing, based on the following criteria: you have returned from overseas in the 14 days before you feel unwell. You have been a close or had casual contact of a confirmed COVID-19 case, in the 14 days before you feel unwell. You have a fever, or acute respiratory infection, e.g. shortness of breath, cough, sore throat, with or without fever. You have a severe community-acquired pneumonia, and no other cause of it is clear to your doctor, with or without recent international travel. If you are a healthcare worker, with direct patient contact and have a fever is greater than or equal to 37.5 and an acute respiratory infection, for instance shortness of breath, cough, sore throat. Treatment: a cocktail of drugs has been used, and vaccine development can help. Complication: 1 pneumonia, 2 severe acute respiratory syndrome. 3 multi-organ failure, e.g. kidney failure. 4 in severe cases death. Prevention: 1 avoid close contact with people who are sick. 2 avoid touching your eyes, nose, and mouth with unwashed hands. 3. Wash your hands often with soap and water for at least 20 seconds. 4. Use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available. 5. Thoroughly cook meat and eggs. 6. Avoid close contact with anyone showing symptoms of respiratory illness such as coughing and sneezing. 7. Disinfection and regular cleaning of surfaces. 8. Regular washing of dirty clothing. 9. Exposure to the sun for at least 2 hours. 10. Put sanitizer in your pocket or bag always. 11. Drink hot water regularly. 12. Gargle of warm and salt water. 13. Avoid crowded places. 14. Leave 1 step or 1 meter from a person with the signs of the condition. 15. Avoid handshakes. 16. Wipe and disinfect your phone with sanitizer. 17. Avoid contact with live animals and pets. 18. Avoid traveling to coronavirus-infected places or countries.